If you have pain running down your leg that's coming from a pinched nerve, then you're going to want to listen to this video. There is a different way to treat this depending on what's going on. You can have a nerve that's scarred down, and you can have a nerve that something is pinching on it. And those two types of situations, you treat them completely different. And if you don't know which type it is, you could be doing more damage than good. The nerve is the most sensitive part of the body, and you don't want to mess with it, because if you damage the nerve, oftentimes it won't come back, and it is the slowest healing part of our body. So we need to make sure that we're being very careful. So in this video, we're going to talk about the two differences and kind of how they feel. We had this conversation with a patient just the other day, which made me think, oh my gosh, I need to make a video on this. And so this particular client was saying that they were getting pain down their leg, and they were afraid that it was from scarring, like from a surgery, because it took the back pain away, but it didn't take the leg pain away. And but she made comments like, if I stand up and I walk, I feel really good. If I bend backwards, I feel really good. And we're like, awesome. She goes, but I feel like it's because it's scarred down. I'm like, the scarred down doesn't present that way. And so we're going to talk about what that looks like and why that's the case. So when you have something that is scarred down, it has to be there for a good 2 months, 8 weeks. It takes about 8 weeks for something to really, really scar down. So if someone's been having pain for a long time, you can't really rule that out. So that's okay. If they've had it for a long time, we know that could be a potential thing. Now, if something that's been scarred down, they present very consistent. It's every time I do this happens, because you're basically, if you have scarring on something and you pull on it, it's going to irritate it because it won't move, because there's something that's there that it's scarred down on it. So it won't move. So it's very consistent in how it presents. And it's not something that will just come and go. It will come when you are pulling on it, which is very different than if you have something that is actually compressing on the nerve. And so if you have something that's compressing on the nerve, this will come and go, because sometimes you're taking the pressure off of that nerve and it goes away. And sometimes you put the pressure on that nerve and it'll come back again. It's variable. And so when you start noticing consistent and variable, then you already kind of have an idea of I'm leaning more one direction or the other direction. Now we can test it. To find out if it really is coming from something scarring, or if it's not, or even just from the way they explain it. So this particular client was explaining that when she got up and she walked, she felt better. Does not make sense if a nerve is scarred down, and I'm going to show you why. So when you think about it, I'm going to use this, and we're going to say this green strap is my nerve, and we put it on our foot. And so I'm just going to show you things that will make it worse, which is anything that's going to put it on a stretch. So if I come up here and I do this. Now, one of her complaints was, sitting kills me. Look what happens when I sit. That nerve is at a lax. It's not at a stretch. So right there, you're thinking, this probably isn't something from a scarred down nerve, because you're not putting any kind of tension on it. The other thing she had said was, walking makes me actually feel better. And so we were saying, all the things you're saying does not make an indication that we feel like anything's scarred down. So again, if I come here and I step forward, it's going to stretch that nerve if it's stuck, if something is scarred down on it. And so if you're walking, and this is what makes this actually can make it worse. Over time, it will make it worse, especially now they'll start taking shorter steps because it doesn't stretch as much, but longer steps, it will stretch a lot more. The other thing she had said was I feel much better when I go backwards. You can see how the nerve isn't on a stretch position if you're going backwards. And if there's something that's pinching on it, the nerves are always in the back. We'll explain this here in a second. And so you're actually taking pressure off it often in some cases. There are other cases where that's not the case. But that was all leaning to us when we were telling her, no, you don't present like something scarred down, but we'll show you the testing that you can do to determine it. Now let me show you what's commonly pressing up against a nerve. Commonly, it's these discs. So we have these discs in between our bones, as you see this. And as we move, if I bend forward, it moves the material to the back. If I go backwards, we can move the material to the front. As long as everything is intact, And what I mean by that is it's not really a ligament. They call it an annulus, but I call it kind of a ligament because people understand that. My patients understand that. And the ligament goes all the way around. It really helps hold everything in. And if everything holds in, then you can use it as like kind of a hydrostatic pressure, and that's why we have a lot of motion and how we can move our spine. But sometimes we do things often where we are always bent forward, we're always sitting, we're always bending. And so when that happens, we can move that material to the back and it can start to herniate and it can press up against this nerve. So most of the time, you press up against the nerve in the back. Now, you can have a herniation to the side, so the level above here can come down to the side, and you can have a herniation, and that also can present that way. But they present very differently. They typically hurt no matter what position you're put in. They want to lie down. They usually want to be in some sort of twisted position. They present very differently. This was not her case. She felt worse sitting. When she stood up and walked, she felt better. When she extended, she felt better. That's because she still has some issues in the back where there's something is not moving. We know that we need to move her into extension because extension is what makes her feel so good. Not the case when you have something that is scarred down. So if you're putting pressure through here, you can see you can put pressure on this nerve. And if you can do motions to make it feel better and worse, and it's variable, very common that you have something pinching the nerve like a disc versus something that has been scarred down. So just asking questions helps us understand a little bit more about what's going on in the back. And in our medical system, we have lost all critical thinking skills. We aren't sitting down asking questions and go, okay, you're telling me this, 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 and this. I have all these different pieces. And when I take those collectively, this is where it's leading me to. But now I need to test it. Now I need to go and see if what I believe is right is actually going to be right. And that's where the testing comes into play. That's where our evaluation comes into play. So we have all this information, and now I want to go and basically hypothesize this is what I think it is. So we'll hypothesize that we think it's probably coming from a disc, but I need to test that and make sure that that is the case, because it really could be coming from scarring. I don't think so in this patient's scenario, but we still have to test it to see if what we believe is correct is correct. So how do we do that? So again, I'm going to pretend like I have my nerve on. Here it is, the screen strap. We're going to put it around the foot again. And so what is a way that we can stress one area and take pressure off another area? And so what do I mean by that? We want to not stress the nerve, but maybe stress the pinched part of the nerve. So if I go in, and we know that most of the time in the back is where we get a lot of pinching on the nerve, if I bend forward and keep on pressing in the front, what I should notice is my symptoms should get worse. One baseline that I would actually do would be stand up and go backwards and just kind of see how you can go backwards. See if you can actually move your spine. See what it feels like. And so again, if you have material in the back and we keep on pushing it more through here, what's going to happen? If there's more material here, it's going to be a little bit harder for us to bend backwards if the disc is a problem. Make sense? So that's what we're going to kind of test to see. So if I go in and I'm bending, it's like sitting, there's no nerve stress through here. So what we typically do is we'll take patients and we'll lie them on their back and we'll bring their knees to their chest and really bend them. So it's taking the nerve out, so we should have no nerve issues. We're not putting it on slack and at all. But what we are doing is we're testing to see if we can make your symptoms worse with your disc. So we bend it and just keep on going, do like 10 of them, and let's just see what happens. So then when we come back up, if you're noticing, whoo, I'm feeling more leg symptoms, that's a sign that it's the disc that is the problem. It is not the nerve being scarred down. Now, when you come back up, if you also notice like, ooh, wait, I'm a little more stiff, that's also an indication that there's something going on within that disc, within the joint itself. And so if you have something scarred out here, it's not going to necessarily limit your range of motion. It limits your range of motion in the sense that when you bend forward, it's putting a stretch on the nerve. So often what you'll find is when someone has dural tension, again, it doesn't necessarily mean it could be coming from the disc. It also could be coming from a nerve. They'll tend to bend their knee so that it doesn't put as much stress, or they'll shift their weight over here because it doesn't put as much stress. When I straighten my knee, it really puts a lot of stress on that nerve. But again, we have to determine where is it coming from, and that's where we're always doing testing. If we go in and we notice, nope, I didn't notice a difference the first time, go back and do it again and just see. If you notice that your symptoms are getting worse, or that you're all of a sudden you're like, I can't bend backwards hardly at all, your symptoms are coming from a disc. And we have other videos out there that'll show you what you should be doing if this were a disc. But the most common thing that we find with patients is that they have leg pain and they go to a physical therapist, and the first thing they want to do is they want to do nerve glides. Oh, your nerve is an issue. Let's do nerve glides. So they go in and they start taking their leg up and pointing their foot and coming back, doing stuff like this. You do not want to do that until you really know where the source of the problem is coming from, because you could make that nerve worse. We see it all the time. We see it all the time on YouTube videos where they literally are showing you, if you have pain down the leg, this is the first thing you need to do. No, you've got to figure out, where is it coming from? Is it being pinched, or is it being scarred down? Because the treatments are very, very, very different. But you can use this video to get a better understanding of where your symptoms are coming from and what you need to do. If you aren't sure and you are confused, make sure you get to someone that really understands the back. And how you're going to know someone that really understands the back is they are sitting down and having a conversation and asking a lot of questions to see how your body responds to different positions and postures, and what makes things better and what makes things worse. These are questions that people will ask, and they'll be very thorough, and they'll go through explaining step by step what they're doing and why they're doing it, and what they're wanting to rule out and what they're wanting to rule in, so that you understand that process. That's when you know you have a good healthcare provider. So if you're wanting some help, just comment down below or reach out to us anytime. We're here to help answer any questions. But this is the testing that you can do for if you have pain down the leg, to determine which one it is. Now, we have other videos that will show you what you need to do if you have something that is pinched from a herniated disc, or if you have something that is pinched, or not pinched, but scarred down from something that's scarred down on the nerve itself. So we have other videos out there. We'll put some of those videos in the comment section or the description. Make sure that you subscribe to our channel, because we provide content all the time, just trying to help you navigate the body and understand like what you can do, and just opening your eyes to other possibilities of things that other people aren't really looking at. We help clients that have had multiple failed treatments get their life back, because we put the pieces of the puzzle together. We often say where the side of the pain is often not where the source of the problem is coming from, and you have to get to someone who can understand all that. So make sure you subscribe, and we'll see you next time.